So welcome to this week's video blog. As with the last couple of weeks, I want to share a couple of COVID related updates and also a couple of non-COVID, more general updates with you from across the organisation. So firstly, in light of the government's recent announcement on relaxing some of the social isolation and social distancing rules to allow people to mix with a slightly larger group of people outside their home, I just want to reiterate that we will be maintaining the same standards and expectations around social distancing within the workplace. So the same rules and standards should be observed when you're working within any of our GP practices or treatment centres, and also the same standards should be observed should you need to come and work at New Century House. So that will include taking your temperature when you arrive at the office, also making use of both floors to find yourself and work safely with good distance between colleagues, using alternate desks, and also just observing good social distancing when moving around the building, when coming into contact with colleagues. So we think this is really important. Obviously, we've had some further data in on our staff absence rates for COVID-related illness. So the full month of May has seen a further reduction to 0.63% staff absence rate in relation to COVID, which is a reduction from 1.5% in April, and a year-to-date average of 0.8%. So we're seeing our staff absence rates decline by the week, which is fantastic news, and a recognition of all the really sensible, good work that all the staff are doing to ensure that they're working and living within social distancing rules, and also the positive impact that the organisation has been able to make in creating environments that allow people to work safely. So our contracts providing out of our services in South Sefton and Southbourne Formby CCGs, which in previous blogs and I think e-bulletins I'd shared, we sadly had to make the decision not to re-tender for that service, which currently comes to an end at the end of September of this year. As a consequence of the COVID pandemic, we were approached by the CCGs asking whether we'd be willing to extend that contract until the end of March 2021. So we've been in discussions with the CCGs over the past few weeks and have reached agreement that will enable us to do so. So we'll be sending out information to staff that work in that service, providing support and advice and information about what that means for them. But in terms of the service, it really means it's going to be business as usual, running right through from now until the end of March 2021. Any staff transfer issues and any service transfer work will begin later on. So obviously we'll be liaising with everybody affected by that at the right time later in the autumn. So I just wanted also to share some information on the new test and trace service that's been trailed in the government press briefings. So there are two aspects to the test and trace service. So firstly, if you yourself suffer from symptoms that might be suggestive of COVID, then you need to follow the same self-isolation rules that have previously applied. So you should self-isolate for 7 days. And during that time, as soon as possible, organise a test for yourself. If the results of that test return positive, then you should continue to self-isolate for the remainder of the 7 days, and other members of your household, as before, should also self-isolate for 14 days. You will also be contacted by the test and trace service by text or by email or maybe by phone and asked to provide details of contacts that you may have had with people that meet the criteria for test and trace over the previous few days and weeks. The second part to the service is that if you are one of those contacts, that you'll be contacted yourself by the test and trace service and asked to isolate for 14 days. So if you're asymptomatic at that stage, then the rest of your household won't need to self-isolate at all, but you will need to do so for the following 14 days. If you become symptomatic during those 14 days, then you'll need to follow the same steps as the first group. So you'll need to organise for a test as soon as possible. Members of your household will need to self-isolate for 14 days. And if your test result comes back positive, then you'll follow the same process as the first group. So you'll be contacted by the test and trace service and asked for contacts that you had contact with over the previous days and weeks. So an email has been sent out by Anna Fox describing that process in detail and also providing some links on the fuller guidance which can be obtained via the government website. So please do look out for that email, have a look at the link, and obviously follow the steps if it applies to you. So the final update from this week's video blog is following on from news that I shared probably 7 or 8 weeks ago now. So we submitted a bid along with our partners, the LGBT Foundation, to NHS England's National Specialist Commissioning Team to provide a primary care transgender health service, which will provide care, diagnosis and treatment to patients across Greater Manchester seeking a diagnosis and potential treatment for their gender identity. We found out at the end of last week that we've been selected as the preferred provider for that service, which we're absolutely delighted about. This is a patient group that traditionally have been incredibly underserved. Some patients waiting 5, 6, 7 years or so just for a first appointment. We're also excited because it allows us to work with the LGBT Foundation as a partner. So that relationship's developed really positively over the last 12, 18 months or so. It also enables us to extend our services provided across the Greater Manchester footprint and work with the Greater Manchester Health and Social Care Partnership. And it also enables us to start to develop a relationship with NHS England's National Specialist Commissioning Group, who are a new commissioner for us. So for lots of reasons, we're absolutely delighted. There's a few contractual formalities to work through over the next few weeks, but we anticipate mobilisation for that service to start in early July. So as details become clearer, I'll update you as we go. So that's it from this week. Stay safe, take care, and as ever, thanks very much for logging in and listening to the blog.